Healthy people don't go to the hospital. Healthy people don't need pharmaceuticals. If you are in good health, you do not need expensive new innovations in pharmacy.
Unless you live under a rock, health insurance premiums are probably going up for you because they're going up basically across the board in the United States. And it is no fun. No one likes to spend more money, especially on health insurance, right? Health insurance premiums. This is, I don't know, David, like you're aware of this, right? That health insurance keeps increasing. Have you
Yeah,
experienced this in your life? Yeah.
we're experiencing it. My family and
And
I are experiencing this. It's I won't even say it's an annual frustration. It's like a annual frustration, and then every single time we have to go in, it's a frustration because I feel like we're paying so much. Why is stuff not covered? This should be covered, but it's not. And then why are premiums so high? Where are the benefits? Yeah, it's a frustration.
yeah, and it's something that I think all of us have to deal with. And for some, it stings a little more than others, depending on where you're at financially. And we're at the time right now where it's open enrollment season. So everyone's thinking about signing up for their new health insurance plans, their healthcare plans. And they're going to see that, oh gosh, I'm signing up for something that's going to be more expensive than I'm used to. How am I going to rebudget things? That's what I'm thinking about. Like, this is impacting, potentially how budgets are made. If you get it through your employer, that can impact how much you're actually taking home. It's just across the board, it sucks. And I wanted to kind of explore a little bit about why this is happening. Why in the United States are we continuing to see increased healthcare costs? So, what I did, and I'm curious to see what you think about this, is I actually leveraged some AI here. AI, our friends, ChatGPT, Copilot, you name it. And I wanted to ask it the question about which entity in the United States is the most to blame for the rising healthcare costs. So here's the prompt I gave it. I did this to two different AIs we'll be comparing because, each large language model might give you a slightly different answer. And I'm curious to see what your predictions are, David. But here's the question that I gave to it. I said, healthcare costs are rising in the United States. Rank the following from most impactful to least in terms of their impact on the rising costs. And these are the ones it's going to rank: pharmacy companies, hospital systems, health insurance companies, the health of the population, and inflation. Now, inflation's thrown in there because, you know, inflation has gone up since COVID-19 for sure. It's been a big political topic if you follow that stuff at all. And so we thought maybe the rise in our premiums is just due to inflation. So let's include that as a possibility. But of course, we have the kind of the three-headed monster there. We have the pharmacies, we have the hospital systems, and we have the insurance. But also, we included the health of the population at large, because as the population gets more sick, that can cause premiums to increase. If everyone needs care, then suddenly you have to flip the bill for the larger number of people who need care, and so it's just going to cause things to go up. So, David, if you had to rank those before we get into what the AI said here, how would you rank those four in terms of the most impactful on the rising healthcare costs in the United States to the least impactful?
All right, can you give them to me again? Give me the list again.
Yeah. So the list is, there's five things: hospital systems, so that's like the care; pharmacy companies, that's drugs and medicines; health insurance companies, that's the payer; the health of the population, just like the population's overall health, so that we're talking in the United States here; and inflation, just like monetary inflation that can cause prices of everything to go up.
Okay, so I would put as a tie for first, inflation and health of the populace.
Okay.
I think we're getting a double whammy there. And then so in third place, I would put Whew, probably for-profit pharmaceutical, and I'd lump within there just to like a little addendum, like the um, more innovative but more expensive procedures would be part of that. So sort of a pharmacy and intervention, medical interventions, um, and that's a byproduct of how expensive clinical trialing is. So kind of a multifaceted thing there. And then at the end, tied for last place, I would say hospitals and insurance, with there being some discrepancies, especially between for profit and not for profit entities. So I think for profit are probably, I mean, they're extracting more profit, of course, from the system. Not for profits doing less. So I'd probably say rather than separate healthcare or hospitals and insurance, I'd probably separate not-for-profit hospitals and insurance from for-profit hospitals and insurance.
Okay, fair enough. So there is kind of like, well, let me just ask you this. If you were to like poll the populace, who do you think they would say is number one to blame?
Insurance.
Do you think insurance? Yeah, and that, so I'll say this. I think the point is, one of the points we want to make here is like all of these have some blame. The question that we're trying to get at is like what has the most blame when it comes to the financial, what when it comes to your wallet. So you ready to see what AI said? Because the two AIs that I used disagree with each other in some ways. In other ways, they're right in line with each other. So are you ready?
I'm ready.
All right, let's start with Copilot. Copilot's an LLM made by Microsoft, and it ranks number one, the health of the population. Chronic disease burden, aging, utilization are key impact areas for the health of the population that's just causing you and I and all of us to have more expensive premiums for our health insurance. Okay. Any surprises there? What's your reaction?
That's very similar to what I was thinking.
Okay, rank number one from ChatGPT, everyone's favorite LLM. No, I'm just kidding. I don't know if it's your favorite, but from ChatGPT, the OG GPT. Rank number one is hospital systems. Impact very high. Reason: hospital care is the single largest component of U.S. healthcare spending, about 30 to 35% of total national health expenditures. The drivers are consolidation of hospital systems has increased pricing power, facility fees, administrative overhead, and expensive technologies all raise costs. And it says an example, a hospital-owned clinic often charges 2 to 3 times more for the same outpatient service as an independent clinic. Okay, let's move over to number two. Unless, do you have any thoughts on that one?
I see where it's coming from,
Yeah. Number
but I don't
two.
agree with it.
Okay. Number two for Copilot, hospital systems. It says the labor, infrastructure, pricing, and reimbursement are the key impact areas. So in both cases, hospitals are ranked in number one and number two. Okay. For number two in ChatGPT, pharmacy companies. Prescription drug spending is 10 to 15% of total healthcare costs, but growing faster. You have high launch prices, price increases on existing drugs, limited competition, which is kind of a big deal and it's hotly debated. Pharmacy benefit manager, PBM rebates, things like that, that all kind of cause pharmacy costs to go up and increase the cost of healthcare in the United States. Speaking of which, Copilot says pharmacy is number three. So that's Copilot's number three, specialty drugs, price, opacity, and PBMs. Your thoughts?
Mhm. I mean, yes, those things have a role, but like my thoughts keep coming down to the health of the population. Healthy people don't go to the hospital. Healthy people don't need pharmaceuticals by and large. I mean, like there are of course exceptions to this, but if you are in good health, you do not need expensive new innovations in pharmacy. You don't need expensive procedures in the hospital. So yeah, all of those things are driving costs upwards, but the demand would simply not be there if people were healthier.
Yeah, that's certainly true.
That's what I'm thinking.
And so you kind of agree with Copilot that health of the population is then number 1. Let's keep going here and finish out the list. So number 4 for Copilot is health insurance. Number 3 for ChatGPT is health insurance. Number 4 for ChatGPT is health of the population. And number 5 for both of them is inflation. It says it's low but rising recently. So post 2021, inflation has had a modest impact on wages, supplies, and facility costs, but it's still smaller compared to structural cost drivers. So I guess kind of what we're so let me just repeat what they were just for those who are listening. The top 5 of each one. So ChatGPT ranked the most to least impactful as number 1, hospital systems, number 2, pharmacy companies, number 3, health insurance companies, number 4, the health of the population, number 5, inflation. Copilot ranked them as number 1 is health of the population, number 2, hospital systems, number 3, pharmacy companies, number 4, health insurance, and number 5, inflation. So the health of the population was where they completely disagreed because Copilot said it was number 1, ChatGPT said it was number 5. They agree on hospital, pharmacy, health insurance in that order. Hospital, pharmacy, health insurance, where hospital being the most impactful and health insurance being the least impactful. But I mean, what you're saying is pretty interesting because it's true that if you stay healthy, you can avoid some of these costs. I think what we're getting at here is that like the rising costs can be happening even if you don't need to spend money on those costs. Like if you don't need care, it's independent on whether or not the cost of the care that you may or may not need is rising, which is the case.
So, Dr. Fowers, you are a data scientist and you spend a lot of time wrestling with healthcare economics and understanding where costs are going and how they're being allocated and seeing real, raw, at scale data for all of these things. You're also someone who follows what's going on nationally, who follows the trends, and you've apparently been talking a lot with AI recently. What do you think
For the
about
second.
those?
Yeah, I tend to agree with you. I think health of the population is probably the one that's like the least talked about and probably the biggest impact on like the cost of our premiums. I do think that like regionally, these can change significantly. When you have an area that has multiple health insurers and one hospital system, the hospital system has leverage over the insurers because there's multiple insurers in one hospital. And so they can kind of pick and choose the most favorable plans. And so in that sense, the hospital is the one who's like probably raising charges or more to blame. We have other areas where there's one insurance company and multiple hospital systems, and then now the health hospital system doesn't have leverage to negotiate with the insurers because there's only like one of them in their area. And so now the insurance company has the leverage to upcharge a little bit or as much as they want in order to, because the hospital basically has to accept it because they have no other place to go. And I think in different areas of the United States, you can have pockets where there's bigger insurance companies that are taking advantage of hospital systems. And there's other areas where you can have hospital systems who are taking advantage of insurers. And so because of that, I think the hospital and health insurance kind of like, it depends on where you're at. So that's where I would kind of, I'd give that nuance when it comes to blaming which system. It's like, well, where are you at? And like, what's your hospital system and what insurances are they working with and how many hospital systems are in your area?
Fair enough.
Pharmacy companies, I do think, uh, I mean, this is a hotly kind of debated topic about what to do with pharmacy in the United States because, like drug prices can be extremely expensive here. There's benefits of innovation of new drugs, but, there's expensive. And you and I both know the kind of process that these drugs go through with the research, the PBMs, and all that. And I do think I would actually put pharmacy above hospital and health insurance. And I might be wrong about that, but I think that's at least an area that might have the most malleability where we could like maybe like impact things potentially. I didn't know where inflation was going to fall, so I'm kind of surprised it fell at the bottom because I think some of it has to do with
I
inflation. You,
I think it should be higher. I think we're still seeing fallout and just kind of a change from, altered supply lines, um, recent political decisions. I think we're seeing a lot of fallout in terms of inflation. And then as contracts are renegotiated year by year, I think it's just taking a lot of time to catch up from the inflation that happened in 2021. I think
Yeah.
that's still hitting us. So I think that's actually more important. I'll stand by my original
Yeah.
assessment.
Eat it, AI. Dr. Hedges knows more, knows better.
Yeah, I'm not that, but
No.
I'm happy to
Uh,
be wrong with it.
yeah. I do think though that health of the population. I think that's where everyone, me, you, Copilot, not ChatGPT, agree that health of the population is high. Like chronic disease burden.
Well, that's how
Unfortunately,
insurance works at the end of the day, right? Insurance, you're betting that your healthcare costs will be lower. Sorry, let me think this through. You are betting that over time, what you invest in to health insurance, you will get more benefit out. But at the end of the day, insurance, for it to be a viable company, it has to make a profit, meaning that it needs to take in more money than it gives out for it to be successful. Otherwise, it'll just collapse. So, I'm not articulating this well, but
no, yeah,
for the system to work, we are effectively paying for everybody's healthcare. And so, if the uh, health complexity of the general population grows, that means that they'll be consuming more and more healthcare. And so each individual's cost will be going up, which means that the average cost per individual is going up, which means that the insurance premiums need to go up similarly to compensate for that. Insurance companies can't just print money and make money up to pay for claims. They have to pay for claims out of the money that they have coming in.
unless you're Medicare or Medicaid, then you can print money because you're owned by the
Uh,
government.
yeah, I don't know
Then
if
you
it
can
works
literally
quite like
print money.
that, but
Well, it seems like it works like that. But yeah, that's a good point. So, I mean, I think both you and I, we have empathy for this increase in cost because, you know, it's increasing cost for
but
us too.
we also work in the healthcare industry. We work in
Yeah.
integrated systems, so we see both hospitals, providers, as well as the insurance side, and both of us can attest that healthcare is on a knife edge right now financially, all across the country.
Yes.
Hospitals are squeezed, insurance companies are squeezed. The extra money that's going into the system is not going to hospitals and insurance. Like we know that definitively. The extra money's not coming here. It's going somewhere else.
Yeah, and it's kind of a mess right now. So hopefully things can settle down a little bit. But in the meantime, we got to think about the individual. We got to think about like, is there anything you can do? Is there anything we can do in order to help out? Like, because we can't change the health of the population, at least, overnight. We can't influence hospital systems or health insurance companies or change the price of pharmacy. Like, there's little things we might be able to do, you know. But when it comes to like something that can have an impact immediately, what would you say, David, if you were to tell someone who's like worried about the rising healthcare costs? What would you tell them to do in order to help mitigate some of this burden and pain with the rising health premiums and healthcare costs?
Two things. First of which speaks to the prioritizations, not priorities, the ranking that we talked about earlier. Take accountability for your own health. Don't just assume that the healthcare organization is going to take care of you, but you need to take care of yourself. And that means you need to work on maintaining your weight. If that means, you can accomplish that through just diet and lifestyle, fantastic. If that means that you should seek out some of the weight loss drugs and work with your provider to seek that out, then do so. Like I think healthy weight is huge. I think consuming a healthy diet, irrespective of where you are with your weight management, having a healthy diet is going to benefit you in tremendous ways. Regular exercise, having quality sleep, and minimizing stress. That is the key to health, in my opinion. So if you really double down on that, take accountability for your health, that is going to have payoffs for you in the near term, mid, and in the long term. And then the second thing I would say is responsible utilization of the healthcare. And what I mean by this, I'll give an example for the emergency department. I know people um, who use the emergency department as a primary care facility. So if they're feeling sick, they'll go to the emergency department. If they're feeling, something happens, they'll go to the emergency department. They won't seek, urgent care facilities. They won't go other places. They won't use nurse hotlines or kiosks or any of that. They'll just go to the emergency room and they'll wait till after hours because that's when they get home from work, all of that. That there are times and places where the emergency room is the right place to go. But if you're just feeling sick and it's not an emergency, that's not the right place to go. And the implications of this are actually pretty significant. Emergency department visits are much, much, much more expensive than other forms of healthcare. If you want to get strep tested, you should not go to the emergency room. If you can't breathe, if you are experiencing chest pains, non-reproducible chest pains, you should go to the emergency room. If your arm falls off and you're bleeding out, you should go to the emergency room. But all of these other things that are not life-threatening, you shouldn't go to the emergency department for. So that would be an example of, responsible utilization of healthcare. Because when you go to the emergency department, you get a response that's as if your life were in danger, and those responses are expensive. That's what I would say.
Wow, that sounded like a beautiful 1 minute for 1% actionable advice, which you get on the Health Elevated podcast. So I sure feel like my health is elevated a bit by listening to this. And for any of you out there, please consider subscribing and leaving us a review, and we'll catch you in the next one.